Absolutely. I'm so glad to have you guys with me here today. Hey, tonight we have knowledge or nonsense, and this is designed for our community, by our community. There's a lot going on with COVID-19, and what COVID has done is caused a lot of myths to come up as if they're facts. And so tonight, one of the first topics we're going to hit is the myth that people of color, regardless of what that color is, people of color cannot catch COVID-19. And without wasting any time and with no further ado, I'm just going to ask some of the people that we have on with us this evening is, what do you think about, like, where do you think that originated from? And why do you think it caught fire? And like people took it and believed it, even though it was a myth, as if it was credible.
Right. So I'll start off. I think social media played a huge part on it. There was definitely this regurgitation of disinformation that we just constantly feed each other. We tend to circle among people that share our thoughts and our beliefs, and we constantly just end up this feedback loop of just giving back the information, putting it back out there. I remember just when this all first started, I was working as an emergency consultant at Boston Medical, and I kept seeing these feeds come up on my news feed, and like my spam. I'm Latino, so my cousins and my aunts were all stating how, oh look, this is only impacting a certain population. It's not really impacting all the populations, all the communities. This is not something we should worry about. When I would take the lift to work, I would see still, people of color, Black Americans, Latinos, also congregating, even though there was these very serious warnings out there that we should, keep our distance, practice these safe measures. And once that fire basically started, it just spread all throughout social media. I saw a lot of things that weren't really credible, and we were just taking it as fact. And then something also that adds to that is what we value as a community. The among the Latinos, among Black Americans, and just we what we value is family. And when someone we see that is in trouble or someone needs help, what's the first thing we do? We come together as a people. I remember that when my mom kept checking up on me, saying how am I feeling? How am I feeling? Even though I'm an expert at this and infection control and stuff, she just kept asking me, "Oh, you should do this," telling me I should do that. She's like, "Oh, I'm going to come over and make you food," and our instinct is that we're not going to say no to our mother. Like these are the values we brought up with, coming in together as a family. But just the congregation of like this mentality of just coming together, it's also what fueled the fire of that spread within our communities. If we look at the countries that it really made a rampage through, like it's all the romance countries such as Italy, France, Spain. These are all very romantic language values where they're kissing and hugging, very touchy. When they did a lot of questions to the families that it spread among cities, they were stating how when they heard about the virus, they ran to their parents' house, no matter how old they were. They were 40, 50, and they would just run. They just went to just be with their family. And in that process of traveling to their family, they were spreading the virus not only to the people in their households, but also in the people on that travel to their house. So it's not only just misinformation, but also what we value as a people. It's definitely healthcare. The healthcare system definitely plays a large part. There's definitely ethnic and racial disparities within the healthcare system, but I feel like right now we should focus more on the misinformation that we are basically feeding each other, and how to basically combat that and just fight that and make sure we do our due diligence and staying above.
I definitely agree. Because ignorance, whether it's intentional or not, it will still have an impact. I was speaking with Lila, subject matter expert. Lila, I'm coming to you, and we were talking about the fact that Oprah had even weighed in on whether a certain population could or could not catch COVID. And so, Lila, I'm going to come to you now. So you can go ahead and unmute yourself if you like. But what do you, with the disparities and the misinformation, the myths, what are some of the things you're seeing, and what's your feedback?
I definitely agree with Danny. There was a lot of misinformation and myths on social media. Facebook, there was memes every day about, if you grew up doing this, ginger ale and, vapor rub, things like that, that if you did those things growing up, you are immune to COVID-19 and you don't have anything to worry about. And I think that misinformation allows people, like, we don't even understand how viruses spread, how bacteria spreads. And it lets you understand the impact of just people who do not have the knowledge of healthcare and work in healthcare settings, that we are in a situation where we can't give enough information to help people understand how serious something like this happens. And it kind of just exploded. And because we work in healthcare, I think I didn't take it as seriously as I heard it when I first heard about it back in January, February. I had no idea this was going to affect my world the way it has today. And it kind of crept up on us all. And I think that we've all seen the changes in policies and procedures, how we interact with one another, schools, every aspect of my life has changed in some way due to COVID-19. And I think that some of the issues with just people of color in general is just us not knowing how serious it affects us, and that we tend to be very close knit as a community anyway. But once it gets into your community, now you have to try to figure out how to help everyone else keep it from spreading further within the community. And you see some of it now. Like, I live in Philadelphia, so um, the fact that we are kind of like a shelter in place, and people are not going to parks as often, but I can walk down the street during the middle of the day and see people playing basketball, riding their bikes, running around the park, walking their dogs, and not practicing social distancing with others, because that's what we're a community. We see our neighbors, we want to sit and talk and have a conversation. We go to the store, we want to have a conversation, and not realizing that we are part of the spread of these type of viruses and things of that nature. But I think that's just part of our community, and what we are. We are people that like to be social. We like to interact with one another. And how do we control that and get people to understand the severity of what can happen when we let this spread within our community?
Excellent. Thank you so much for your feedback. Mr. Perkins, did you have anything you wanted to share before I go into introductions?
Sure, sure. The information being promoted on social media and in our small and intimate circles.
I think Mr. Perkins.
I believe we've lost Mr. Perkins. So what we're going to do is we'll go ahead and I'd just like to let you guys know who we have with us today. We have Lila Price, CRCST, CER, and CHL. She is the Education and Quality Specialist and with the High Level Disinfection Program. She's hailing out of Philadelphia, as she said, and she is a subject matter expert. Many of you in the field are familiar with Lila. You've seen her. You've seen her in Florida. You've seen her on the East Coast. You've seen her at Isham. You've seen her educating people, and she's very passionate about this field. So we're glad that we have her here and that she's taking time and sharing her expertise with us. We also have Mr. Danny Vasquez, CRCST, CIS, and CHL as well. He's an emergency management consultant, and he has over 15 plus years in healthcare. He graduated from NYU, majoring in healthcare management and minoring in community health. So this is definitely in his wheelhouse. So if you have any questions, if you're looking at us on Facebook, on YouTube, wherever it is, if you have any questions, please feel free to ask us those questions. A little later, we'll have something called a hot seat. So if you have a question that relates to sterilization, that relates to COVID, that even relates to some of the practices that we are being asked as sterilization, as reprocessing experts, some things we're being asked to overlook or circumvent, go ahead and put that in the chat box, and we will do our utmost to respond in a way that helps you and helps you. We're a community, and we learn more at the round table together. And so going into that, I do have a question here. So I'm going to set this question up. If everyone can see, Ms. Sherry's asking if we find that younger people ignore the warnings more, like more younger people ignore warnings. And so, what we'll do, we'll let that be our hot seat question. And right before we get into that question, let's go back to, we talked about the fact that that's a myth. Anybody can catch COVID-19, correct?
Yes.
Absolutely.
Anyone
Yeah.
can. So let's go a little deeper. Let's take a deeper dive, if you guys will. I'm going to come back out, and I would love for you to take a deeper dive into the dangers of misinformation as it relates to COVID, as it relates to even some sterilization processes and things. When people who may not be familiar think that something is, because it's clean, it's sterile, or because it's clean, it's still safe to use. So can we take a little dive, a little swim for a second into the dangers of misinformation?
Yeah. I want to start off by basically piggybacking off what you said, Sharon, about how Oprah, and you saw a lot of this information circulate on TV, on the media, on the news. They were circulating the information how if you hold your breath for 10 seconds and you could hold your breath fine, you don't have COVID. There was a couple of those TV personality doctors that got in trouble. I think it was Dr. Drew got in trouble because he said COVID is not serious. It's less serious than the flu. We shouldn't worry about that. He ended up apologizing about that later on. But you saw someone else like Dr. Oz also saying that the doctors in the hospitals, the nurses in the hospitals are getting sick more because of the anxiety of the virus instead of the virus itself. And as time passed on, we realized that they were very wrong. And even though there's a lot of experts out in the field, something that someone I read somewhere is that expert opinion should always be considered the lowest form of evidence. Even though we've been in the healthcare field for X amount of years and we've done this pretty much our whole life, doctors have been training all a significant amount of life, but what they still do is called a practice because everyone's in this together. We're still trying to figure out information. The way we verify information and what we're dealing with is basically through case studies, through these analysis, through randomized studies as well. That's how we figure out what exactly we're truly dealing with. And touching on what Karen Cherry stated in her question that do younger people feel like they're invincible to this disease? And I feel like that was the mentality a lot. When you're at that young age, and you're 21, 22, even in your teens, you have this egocentric view that, nothing could really hurt you. And even though the stats did show that, it's impacting more people with pre-existing conditions, something that is more rampant in our communities, as people of color, such as diabetes, hypertension, those things were impacting us more, but it wasn't impacting so much mortality rate wise to the younger population. So they were basically out there, being interviewed by the TV station saying that, oh, we shouldn't worry about this. But going back to the whole point of misinformation, I feel like we should just do our due diligence and looking into the studies and not worry about what social media is saying. We're so used to just seeing that little prompt on a little blurb on Facebook and just sharing it, not even clicking the actual article, reading through it. We just share the snippets. And now we know that clickbait is a very serious thing. So even though it says, the sky is purple, someone will reshare it, but it's just a completely clickbait title. So I feel we should be just doing our due diligence, looking at the studies, looking at the research, doing our own research before we make any final decisions or thoughts.
Excellent, excellent. How about you, Lila? What are some of the dangers that you've seen? Just even if it's not a danger may be inflammatory. Some of the either dangers or the results that you've seen from misinformation, definitely like either tomorrow or the next day, we'll talk about some things with the mask and reprocessing. But what are some of the things you've seen associated with misinformation for us within this field?
Within the field, I feel that we haven't done enough research to understand. I know that we're going to talk about these topics later, but this with reprocessing of masks, wearing PPE for extended periods of time. Those are the things that I think that we haven't had enough information to tell us that it's okay. And to have people in a situation where they're working and in a situation where they could very well come in contact with anything, it's very trying to figure out the best way to say this, but it's just not the best opportunity for us to go and start throwing away all of the things that we know about infection prevention and control, or even putting them to the side because we're in a crisis. I feel that now's the time to vamp it up even more, to be more alert, to have the opportunity to teach people what it is, what proper hygiene can do for us and how it helps us, and the necessity for being able to have disposable PPE. So looking from my point of view and my lens, I understand that we are in a crisis with trying to acquire those materials and things of that nature, but not throwing away all the guidance and all of the years of known, proven, information out the window because we don't know how to battle or to combat against something that's new and different in our settings. So I definitely believe that policies and procedures have been changed. I've helped change some and assisted with those in my healthcare facility and given advice. And I definitely feel that it's being a little leery. I don't know because there's not a lot of evidence based behind certain things. And even though we're doing our own risk assessments and we're doing our own due diligence in the background, it makes me nervous just because I know that there's some things that, we can't change and alter. And I would never want to put someone's life in risk or tell someone to do something that I myself wouldn't feel comfortable doing. So it's that morality and knowing that we're in, of course, we're just in unknown times. We've never been here before, and we don't know how to kind of proceed and act and travel through this mess. But I also feel that we shouldn't abandon what we know to be true, and try to hold on to those core values and stick it out and just try to give people the best information from what we know, and not to change it often and every day. So.
Excellent. Thank you so much for that. Mr. Perkins, I see that the broadband is trying to keep us away from your wisdom, but we will have it. We will have it. So as we're about to shut it down, very good answers, very good insight. Thank you guys so much for sharing insight from the heart. Thank you, Ms. Cherry, for asking the question about young people and whether the urgency they responded with was commensurate with the threat or not, So for our hot seat question, as we're about to get out, you've already weighed in on Ms. Cherry's ask about the young people. Hot seat question. During this time of uncertainty, I'm asking the question, hot seat, during this time of uncertainty, lots of people are being furloughed. We know that the surgery volume is going to come. Summer's coming. That's trauma season. On the hot seat, what would you share with your colleagues as you are on air now? And if you weren't on air, if you were just at the coffee shop, what would you share with colleagues and other members of your profession on something like to do with this time? Because it's an uncertain time, and there have been some unfair things that happen, and there have been some fair things that happen where people have found places for people to work. What type of feedback would you have for the crew, for us, as other people in this field?
Okay. Well, I'll go first if that's okay. I think we are so great as professionals in our field. We have so much substance, and we're naturally givers, right? Anyone in healthcare is a natural giver. I think a time like in any crisis is a time to give back, to give more. Go out and inspire someone to learn something new. In any crisis period in our country, and the biggest crisis in my lifetime was 9/11. We were able to reinvent relationship, go check on a neighbor, go mentor someone who needs some wisdom at that time. So this is the opportune moment that we can reinvent ourselves and give someone else a second chance. So give back. Remember what we signed up for in healthcare. One oath, Hippocratic oath that surgeons and physicians swear into is do no harm. But we can do so much good. So just give back, inspire someone, uplift a neighbor. I think this is the opportune time to form that common unity or community, re-engage in your community, whatever that means to you and in your place of residency.
That was great. And just to piggyback off that, and touch on the theme that we're on about misinformation, when you're basically having a dialogue with your community or your friends or your colleagues, always think about the consequences of what you're saying. I feel like during this time we should be positive, even though the facts are very, somewhat gloomy and dark, but we should always remember that this too shall pass. As long as we are empathetic, we work together, we will overcome this. It's going to be hard and it's going to be a long battle, but I feel like as long as we keep educating ourselves, be proactive about what we're doing during this time. Right now there is a lull in surgeries, but we could use this time, like Mr. Perkins said, just to educate ourselves and one another. As long as we're doing that and staying just ahead of the ball, I feel like we'll come out of this stronger than ever.
Agreed.
Well, thank you guys so much. Oh, I'm sorry. Go ahead, Ms. Lila.
I'm sorry. I just wanted to add that I know that this was something I thought about a few weeks ago, and I had even posted a poll on the Facebook group that I'm an admin for, just asking people, especially travelers, what their end of contracts look like. Were they still on? Were they working? Were their hours reduced? Because I generally cared, and I just wanted to put it on notice and let people know that we were thinking of them and that we were caring about them and concerned about their situation, but also as a voice, and so that people can, to me, I feel like, at some point the country will go back to, business as usual. And I think that as responsible consumers and as employees and employers, we need to be responsible about who we work with in the future, and to take notice of how people how they're treating other people. How you handle this situation says a lot about your company, the integrity of who you are, and how you care about people. And so for me, it was more of a question to find out, okay, your contract may have ended early, but did your recruiter make sure that you were able to get home? Did they offer you any other job opportunities? Were they able to assist you with something else? Maybe you have another skill in a trade, and maybe there was some other market for you to go into and do other things. My employer, I can say, was excellent during this time frame, that they were able to, put up things on the marketplace of other opportunities to work in other areas if you had another skill set and things to do. And that became beneficial for some people who needed hours outside of the normal hours that they work because of other things, like, children being out of school and not having opportunity for childcare and things of that nature, or, trying to navigate homeschooling with working and things of that nature. So I just paid attention to a lot of what I see companies doing, because to me, that's what I'm going to look at when I do go out and be a consumer again. Or even if I'm looking to be hired by someone else, what did you do during this crisis, and how did you help and assist people? How were you there for them and gave them some type of aid? And I hear stories all the time from other people. I know that there's restaurants who have been that are not doing seating, but they are giving meals to their employees, 1 meal a day. That to me is awesome. Like, at least they're trying to help during these times. And those are the things I pay attention to. And that's how I'm going to remember this going forward, is, what I gained, what I learned from this experience, and how I can help others. And but paying attention so that we know that as the driving force, the technicians out there, pay attention to how these companies were treating you, these hospitals were treating you during this time, so that we can gather and have a voice, and that, those may be things we look forward to in our next contracts. If for some reason there is a crisis, how do we prepare for that, and how do we get, compensated for that, and those type of things. So I just ask people to challenge, to think outside the box, be patient, because things will go back to normal, but also be caring and to help out, because if there's anything that I can do, I want to make sure that we come out of this ahead. I've told people, go get another certification while you have this lull time. Do something productive to help you, so on the other end, when you come out of this, you can be stronger than you were when you started.
Absolutely.
Excellent. Excellent. Thank you guys so much. Lila, as you were speaking, it made me think about my mom said to me a couple of times in my life, she was like, take note of how people treat you when they're angry.
Mm-hmm.
A lot of people, before she said that to me, a lot of people are like, well, they're mad. They didn't mean what they said. She said, no, take note when people are angry, because that's the time when things actually come out, not when they're hurt, but when they're angry. And that's been crucial in my life, So I do want to thank you guys for just for your feedback tonight. I look forward to speaking to y'all again.
You.
Same bat time, same bat place tomorrow. Just because you're the subject matter experts, I'm hosting this. I want to give a shout out and a huge thanks to CS Assist, the one-stop shop for everything sterile processing. Is such a great resource, a good library resource. They're sponsoring this. SIPS Consults is sponsoring this. And both SIPS and CS Assist, I know that throughout this time, they actually did take care of their employees. They were like, if you test positive, you don't have to worry about your paycheck stopping. We'll still give you that pay. And so, yeah, definitely, we are a community. We are professionals. And I love the fact that even though we talked about things and had hot seat questions, we do let science back. We want to make sure that that there's evidence-based science on these decisions that we're making, because lives depend on it. Hey, Mr. Perkins, I'm sorry I didn't get to get you in as much. Maybe we will work some things out with the broadband. Anything on your heart before we close this out?
No. Learned a lot. Enjoyed the dialogue, and thanks for hosting the channel. So it is needed, and it answers a lot of real time issues and questions that people were pondering. So thank you.
Okay, and for those of you out there in SPD world, CSPD world, if you have a question, anything from reprocessing a mask to the PPE you're wearing in decontam, what you can do when the volume is low, when the census, your surgery census is low, any of those questions that you have, you can email those. You can you can share them with us in a private message. This is for us. This is to help us navigate this right here, and to find out things that are nonsense versus knowledge. Just because someone says it doesn't mean it's so. So if it's nonsense, we want to go ahead and identify it as such, so no one gets hurt, and we don't hurt even anyone outside of this when the volume comes back up, by practices that we're doing in this transitional time. So please send your questions in. Everyone have a good day. Thank you so much, Danny. I'll talk to you tomorrow. Lila, talk to you tomorrow.
Likewise.
Mr. Perkins,
Thank you.
I'll talk to you soon.
Good night.
Have a great one.
Pleasure.
Likewise.
Thank you.